Let's get now to India, where there is a lack of oxygen supply, scarcity of hospital beds, and daily COVID cases rising beyond control. Those are some of the devastating details out of India, as the World Health Organization calls the situation beyond heartbreaking. With details on what's happening there is co-founder of South Asian Health Network, Sabina Vohra-Miller. Good morning to you, Sabina.
Good morning.
I understand that you do have family and friends on the ground there. Can you describe for me what they have told you and what you are hearing?
Yeah, what's happening in India right now is essentially a humanitarian crisis. It's so heartbreaking and so devastating. They're at a point where all of the hospitals are essentially completely full. They're building makeshift outdoor hospitals. But even if you do get a bed at a hospital, there's a lack of actual supplies. There's a lack of medications that are needed. There's a lack of oxygen. Many hospitals are basically on the brink of having zero oxygen left. There are people who are begging for oxygen nonstop. My father lives with me over here, and he's been spending a lot of his days trying to contact our family, our friends who are there. My entire family is actually in Delhi, in India, and trying to understand what's going on, who is sick, who is hospitalized, who needs care, who needs oxygen, and who's trying to crowdsource some of these materials as well.
It's horrible to hear these numbers, and I don't want to glaze over these numbers by any means, and to give our audience a perspective here. So as of Monday, India recorded over 350,000 daily COVID-19 cases. The latest number, still over 320,000 infections in 24 hours. Obviously, something needs to be done. We've heard about some support coming from the international community. Where do you stand, and where do Canadians stand with what we can do?
Yeah, there's so much that we can do over here in Canada. First of all, I think what we really need to be doing is pushing Canada to waive IP patents on vaccines. Like we're basically in a global pandemic. We need vaccine equity, and we need to be doing that. We need to be also making sure that AstraZeneca vaccines that are produced in India by the Serum Institute are actually rediverted back to the Indian population, because they absolutely need it. At this point, their vaccine, rate has been very low. They've actually been distributing majority of the vaccines that they've been manufacturing, at this point, only 10% of the Indian population actually has one dose of the vaccine. The other thing we need to be doing, if possible, if Canadians are able to actually contribute to send resources, to send funding, to send relief, things like oxygen, pulse oximeters, that would be incredibly helpful. We're collating a list of Canadian organizations that are currently fundraising, and if Canadians are able to help, and also speak to your MPs, your MPPs, try and get relief and aid to be sent, would be so helpful as well.
Sabina, where can people find out more information? Because you mentioned a number of different organizations, but is there one central place that people can head to?
Yeah, so currently we're trying to collate a list, and we can find it at indiacovidsos.org. We're basically a coalition of healthcare professionals in the US, Canada, and Europe that have come together. We have daily calls with those who are physicians and others in India on the ground, just to understand what the situation is, what the greatest needs are, and we're using that to actually collate the list of the most needed necessity items right now. So indiacovidsos.org would be the place to go. The South Asian Health Network will also be collating a similar list. So if you wanted to check out the South Asian Health Network, we will be putting some of that information on our website as well.
All right, Sabina, thank you for all the work that you are doing, and we are thinking of all of your family friends who are there right now. Thank you.
Thank you.
It is 7:10 is what we're sitting at. We're going to bring you more news in 20 minutes time. Right now, we join the gang. Good morning, Dina. Welcome back.